Hey, I got a video for you about how to make your knee mobility better. Now, why better knee mobility? Well, it's going to make your knee healthier and very possibly allow you to squat better as well. And the thing is this with the squat, some people tend to, when they struggle to squat, they tend to focus a lot in their hip mobility. Nothing wrong with that. It definitely helps the squat, but if you have done that a lot and it didn't really take you as far as you like, and then maybe another area you want to look at is your knee mobility. All right, so now the classical way of looking at the knee joint is that it is a hinge joint, right? So it just extend and flex, but the knee joint actually rotate as well. So if you rotate the shin bone, all right, so the shin bone is here, so rotate the shin bone. The knee joint, rotate the shin bone. The shin bone rotate because it rotates at the knee joint, right? Hopefully this makes sense. Now, I'm going to ask you to put your hands, both hands behind your back of your legs, the hamstring muscles. So this hand will be on more the medial side of the hamstrings, which means it's closer to me, and then this hand more outside. And what happens is this: if I turn my shin inward, I will feel that the hamstring on the inside here will fire harder, all right? And then if I turn outward, my shin bone is turning outward, I will feel that the inside soften up a little bit, but the other side tense up more. So the outside, the lateral side of my hamstrings will turn on more, and then I turn in again. All right, I feel this tightening up, that's good, and then stay here. So when I turn my foot in, or turn my shin in, to be more accurate, the shin in, when I do that is my internal knee rotation, and I can feel the hamstrings here on the medial side firing up a little bit harder than usual. And then if I turn it out, which is external rotation of the shin bone at the knee joint, my lateral side of my hamstring will fire up more. And then I'm going to go in now, all right, and stay here. All right, you should not be in any pain. There's no pain here. And I'm going to hold this position and feel the stretch here on the shin side of the shin tissues here, right? Okay, and then I'm going to stay here and stretch a little bit. Okay, and what's going to happen is I'm going to bring my arms underneath my knee joint because I want to lock this in place. I don't want this knee to wobble around. All right, I want it to stay still, stay right there. And the thing is here is this we're going to do is we're going to do the thing called PAILs and rails of the internal rotation of the knee joint. All right, so what that means is when I do PAILs, I want to sweep this foot out, but I'm blocking it. I can imagine suction caps underneath my foot, sucking the floor, so it's not going anywhere, so I don't have to use my hand to block it, but you can. You've got to use your hand to block it. All right, so in this case, I'm not going to block it. So I'm going to push it out. I'm going to try to sweep it out, but I'm stuck 20% max, 40%. All right, and then those percentages is just a sort of estimate like how hard I'm firing up the tissue. So I'm going to slowly ramp up to the highest, safest possible, and I can feel all this tissue firing up. And I can put my hand here. I'm going to move my foot in the rails effort, which is the regressive tissue firing up, so the inside tissue. So probably the hamstring here, going to turn it on very hard to turn it in. Turn it in. The hamstrings on the inside is turning in, away from this original spot. All right, and then I'm going to stay here and relax here. All right, so I just made a new position here and relax. So when I do the rails, I probably want to like do about 10 seconds. So I probably did about 3 to 5 seconds, a little bit short, but that's okay. And that's my knee joint in a more internally rotated position. All right, and then I'm gonna sweep out and then take it into the original spot. So as you can see, I'm just rotating at my knee joint. Cool. All right, and hope you like this, and give it a shot. If you have any questions, please ask in the comment. And if you really like this video and think it helps you, please help me share this video with your friends who want to find out more about how to make their knees healthier and actually squat healthier too.